So today I'll be discussing about reversible dementia. So coming to the definition of dementia, dementia is defined as progressive impairment in cognitive function occur in clear consciousness, that is in the absence of delirium. So first of all, first is patient should not be in delirium, like there should be absence of delirium. Patient should have clear consciousness, correct? Now, which is defined as progressive. Progressive means it is not stagnant. It is progressing over the period of time. Right? Impairment. There is impairment in cognitive functions. So progressive, the impairment of cognitive function occur over a period of time, occurring in a patient which have clear consciousness. That is, the patient does not have any signs of delirium. Is known as dementia. So coming to the classification of dementia, one is reversible, irreversible, and psychiatric disorders. So for the reversible causes, the mnemonic is dementia itself, D for drug intoxication, E is endocrine causes, for M is metabolic disturbances, E is for eye and ear impairment, N is NPH, that is normal pressure hydrocephalus, nutritional disorders. T is for tumor, trauma to head, that is subdural hematoma, infections, and alcohol. Irreversible causes are Alzheimer's, FTD, Huntington's chorea, DLB, vascular causes, leukoencephalodystrophies, and Parkinson's disease. Certain psychiatric disorders that cause dementia are depression, schizophrenia, and conversion reaction. So coming to a very important concept asked many of the times is difference between cortical and subcortical dementia. So the cortical dementia, the symptoms will be major changes in memory, language and perceptual deficits, apraxia, lack of extrapyramidal features. Whereas in case of subcortical dementia, there will be behavioral changes, impaired affect and mood, motor slowing, executive dysfunction, and it shows less severe changes in memory, extrapyramidal features. One important differentiating point is extrapyramidal features will be absent in case of cortical dementia, whereas it will be present in case of subcortical dementia. Areas affected in case of cortical dementia are temporal cortex, parietal cortex, and frontal lobe cortex. Areas affected in subcortical dementia are thalamus, striatum, midbrain, and striatofrontal projections. Cortical dementia examples are straightforward and very simple. Alzheimer's disease, dementia with Lewy bodies. Frontotemporal, it affects the frontal lobe and parietal temporal lobes. So it's frontotemporal dementia, vascular dementia. Example of subcortical dementia, it affects the thalamus and the striatum. So Parkinson's disease, progressive supranuclear palsy, NPH, Huntington's disease, the spine disease, that is CJ disease, vitamin deficiency, thyroid disorders, metabolic causes, dementia pugilistica. So discussing another very important topic, that is difference between delirium and dementia. So delirium is a global cognitive disorder, both of them, right? There is impaired function of neurons in delirium, there is death of the neurons in dementia. Delirium is usually of acute onset, dementia is gradual onset. There is global amnesia, complete loss of orientation, attention, and short-term memory. There is selective amnesia, attention loss is far more significant than long-term, if long-term loss is present at all. Delirium, very important point is it is waxing and waning type of severity. Sundowning, it gets worse at night due to the loss of long-term enabled orientation cues in case of dementia. Delirium causes are usually reversible, which is infectious, metabolic, hemodynamic, respiratory, toxic, and traumatic. The causes of dementia, as discussed earlier, are Alzheimer's, multi-infarct dementia, untreated delirium leading to permanent neuronal damage. EEG always reveals an abnormally slow rhythm. EEG in pure dementia shows a baseline rhythm of normal frequency unless the condition is sufficiently advanced. Misdiagnosed, confused with acute psychosis, agitated mania. Misdiagnosed as pseudodementia in elderly. Elderly are often diagnosed with dementia when in fact they have just depression. So it is very important to differentiate depression and dementia in the elderly people. Frequently multifactorial etiology, frequently exacerbated by other conditions that complicate it, such as depression and alcoholism. Prognosis is poor in case of dementia, and recovery is good if treated on time in case of delirium. The treatment is treat the cause of delirium, and dementia is cholinesterase inhibitors. Alcohol-induced dementia, prolonged and heavy ingestion of alcohol results in amnestic disorder known as Wernicke-Korsakoff syndrome. It is generally attributed to thiamine deficiency. The mnemonic is GOA, that is global confusion, ataxia, and ophthalmoplegia. Ophthalmoplegia usually lateral gaze palsy, Korsakoff syndrome, anterograde and retrograde amnesia, confabulation, and hallucinations. Heavy metal toxicities like occupational exposure, iatrogenic toxicity with bismuth, gold, lithium, and aluminum. Chronic and heavy metal toxicities like lead, arsenic, and mercury. The infections which cause dementia, most important is HIV. Fungal infections like Cryptococcus, Candida, Aspergillosis, Mucormycosis, Histoplasmosis, Coccidioidomycosis, and Blastomycosis. Syphilis, tuberculosis, and neurocysticercosis.